Hello, I'm Scott Mercado with KRWG Public Media, and welcome to In Focus. Recently, Ideal Option, one of the nation's largest outpatient providers of medication-assisted treatment for addiction, published their 2023 annual patient outcomes report for patients living in New Mexico. And here to talk about some of the findings of the report is local community outreach coordinator Athena Huckaby. Welcome, Athena.
Thanks, Scott.
Well, let's start by talking about what is Ideal Option and how does the program work?
Sure. So Ideal Option is a low barrier medication assisted treatment provider. We also are sometimes calling that MOUD, or medications for opioid use disorder. So we're a clinic that provides medications for opioid use disorder, as well as alcohol, cannabis, methamphetamine, and other substances that people are having challenges with.
Well, tell us about Ideal Options 2023 Annual Patient Outcomes Report. And before we break down the findings, what kind of general information does it cover and how is it compiled?
Sure. So most of the information included is based on our urine test results. So when people come in and leave a sample, right, that shows all of the things that are in their system, including the medications that we're prescribing, as well as medications that they're taking, possibly illicitly or even with a prescription. We have time of flight mass spectrometers and can see really everything that's present. And so based on those results, we can tell what drugs are cycling in a community, whether certain adulterants are present in those drugs, and certainly we can also tell what people are using, how long it's staying in their system, and whether they're taking the medications that we're prescribing to them.
Well, one of the report's key takeaways is that polysubstance or multiple drug use remains prevalent, with 65% of new patients at Ideal Option testing positive for that. So talk about that finding and what drugs are the most prevalent.
Sure. Really quite easily the two most prevalent drugs in New Mexico are fentanyl and methamphetamine. So fentanyl has essentially supplanted heroin in the drug supply. It's very hard to get heroin these days. Even law enforcement will tell you that heroin seizures are way, way down, whereas fentanyl is really the prevalent opioid of abuse that's in the supply at this time. It has a lot of problems as a maintenance drug, and so people tend to couple it with methamphetamine to counteract the sedating effects. In addition, there are often other things present. For example, we found 10% of our test results tested positive for xylazine, which is a common adulterant that's being found sort of all across the nation these days. So we can see all of that in the urine test results.
Well, another takeaway is that lab results confirm materially reduced consumption of illicit substances as patients progress in treatment. Positive rates for fentanyl and methamphetamine declined by 97% and 88% respectively. So tell us about that and what you attribute such a huge decline in usage of those substances.
Yeah, I think that this points to the fact that medications for opioid use disorder are very effective. And we've had this evidence for a long time. Methadone, for example, which is one of the FDA-approved drugs for use with patients with opioid use disorder. We don't prescribe methadone at our clinic, but it's the one that's been around the longest, has a really robust body of evidence. And buprenorphine, which has been on the scene for maybe about 15 years as an FDA-approved drug to be used for opioid use disorder, also has very, very good outcomes, to the point where there was actually a recent study that came out of Yale that showed that treating people with opioid use disorder without the use of these medications is worse for patients than giving them no treatment at all. So I'll repeat that. Essentially,
Why is that?
Because of the neurobiology and the changed brain that results from opioid use disorder. Essentially, it's not the same as alcohol use disorder or other use disorders where people, are sometimes successfully able to quit and stay stopped. Fentanyl use disorder, heroin, these drugs cause changes in the brain that require the use of these medications. And when they're given, they're extremely effective.
Well, another finding is that after 6 months of treatment, patients report meaningful improvement in housing, employment, finances, physical and mental health, and relationships. Can you expand upon that, especially in the area of housing?
Yeah, absolutely. I think that medications for opioid use disorder really help people to regain a sense of stability and be able to function in daily life. Fentanyl use disorder especially is so debilitating. The half-life of the drug is very short. Unlike heroin, where people used to be able to get well or use, maybe 3 or 4 times a day, with fentanyl, people are having to use many, many times throughout the day, sometimes smoking as many as 30, even 50 pills a day. So basically your whole life is consumed by pursuit of this drug. And if you're able to get on something that helps you get some brain stability, you're then able to do the things that you need to do to sort of get your life together.
Well, finally, were there any other findings that stood out for you or surprised you in the report?
I think I've been working in this field a long time, so I'm often not surprised by how great our outcomes are, but I think that other people are often surprised. There's still a really large stigma around people using medications for opioid use disorder. Many people will refer to it as a crutch. I was in even a pretty prominent statewide behavioral health meeting where somebody was advocating people need to get off of these medications as soon as possible. And that was with a knowledge base, like somebody that should know better, really, right? I can understand those types of attitudes still being present in the public, but when they're present in our public health professionals, that's really challenging. So, there's a lot of stigma still around these medications, and I think something like our report that shows how much people are able to improve and how much it improves their lives really helps to eradicate that stigma.
So this report will come out every year?
Yes, we're actually the only drug treatment clinic I know that publishes a report of this nature, and Ideal Option is located in 9 states. We have over 200 addiction medicine providers working for us. So we have a national report that we issued, as well as a report in each state in which we practice. And we have 5 clinics here in New Mexico.
All right, Athena Huckaby, Community Outreach Coordinator, thank you for joining us. And I'm Scott Mercado, and thank you for joining us for In Focus.